Hey, how's it going, everyone? This is FixerMed. Welcome back to my high-yield biochemistry review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 16B of my multi-part video series covering the entire discipline of biochemistry in a comprehensive but high-yield manner. This video will be an expansion from the vitamins video that I just uploaded, so I'd recommend watching the video on the vitamins before doing the questions. But unless if you have a solid background in vitamins and biochemistry, so it's your choice. But without further ado, let's go ahead and get started on questions. So we have a 17-year-old female who is currently on oral contraceptive pills, OCPs, and having taken isotretinoin for acne over the past 2 years, she presents with a headache. She adheres to a vegan diet. Which vitamin deficiency is most likely responsible for her headache? Pretty first order questions, so if you need more time, just go ahead and pause the video. If not, I'm just going to go ahead and move on now. The patient's history of taking high-dose vitamin A throughout isotretinoin for acne combined with the use of OCPs, oral contraceptive pills, raises the suspicion of pseudotumor cerebri, characterized by increased intracranial pressure and headaches. Both isotretinoin and OCPs have been associated with this condition. Veganism, as mentioned in the patient's lifestyle, is related to potential B12 deficiency, but is not associated with headaches. Therefore, the correct answer in this question is vitamin A. Let's go ahead and take a look at why the other answer choices are incorrect. The incorrect choices can be explained as follows. Vitamin B1. Thiamine deficiency is not linked to headaches in this context. Vitamin C. Vitamin C deficiency, scurvy, is not associated with headaches in the given scenario. Vitamin D. While vitamin D deficiency can cause various symptoms, it is not directly related to headaches in the context of isotretinoin and OCP use. Vitamin B12. Although veganism can lead to B12 deficiency, it is not implicated in headaches in this particular case. So let's go ahead and move on to the next question. An investigator is studying an enzyme that is a giant complex involving several vitamins. Which of the following enzymes is not most likely being investigated? Pretty first order questions, so I'm just going to go ahead and move on now. If you guys need more time, please feel free to pause the video. If not, moving on now. Pyruvate dehydrogenase is a large enzyme complex involved in converting pyruvate to acetyl-CoA as part of the tricarboxylic acid cycle, known as the TCA cycle. This complex is often referred to as a giant complex due to its association with multiple cofactors, including vitamins B1, thiamine, B2, riboflavin, B3, niacin, B5, pantothenic acid, and lipoic acid. Therefore, the correct answer is C, pyruvate dehydrogenase. Let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. Hexokinase. Hexokinase is involved in the phosphorylation of glucose and is not typically described as a giant complex with multiple vitamins. Catalase. Catalase is an enzyme that catalyzes the breakdown of hydrogen peroxide, and it does not form a giant complex with multiple vitamins. Amylase. Amylase is responsible for the hydrolysis of starch and is not associated with a described giant complex involving multiple vitamins. Ribonuclease. Ribonuclease is involved in the degradation of RNA and does not form a giant complex with specified vitamins. Let's go ahead and move on to the next question. We have a 42-year-old male known for alcohol consumption. He presents with a high mean corpuscular volume, MCV. Which combination of serum methylmalonic acid and homocysteine levels is most likely in this patient? I'm going to give you guys a few more seconds for this one, and then we're going to move on. It's more second order, I'd say. Alright, moving on now. If you need more time, just go ahead and pause the video. The patient's alcohol consumption and elevated MCV suggest folate B9 deficiency and B9 deficiency to methylmalonic acid or Malonyl-CoA levels remain normal while homocysteine levels increase. The learning point is that B9 deficiency primarily affects homocysteine levels, distinguishing it from B12 deficiency. Therefore, the correct answer is B, normal methyl malonylic acid, elevated homocysteine. Let's see why the other answer choices are incorrect. So, elevated methyl malonylic acid, elevated homocysteine. This pattern is more indicative of B12 deficiency, which involves both elevated methyl malonylic acid and homocysteine. Elevated methyl malonylic acid, normal homocysteine. This combination is not typical of either B9 or B12 deficiency, as B12 deficiency would usually lead to elevated levels of both methyl malonylic acid and homocysteine. Normal methyl malonylic acid, normal homocysteine. This combination does not align with the expected pattern in folate deficiency, where homocysteine levels are typically elevated. Decreased methyl malonylic acid, decreased homocysteine. This combination is not associated with B9 or B12 deficiency, and it does not reflect the observed pattern in the patient's presentation. Now, guys, that will do it all for vitamin questions. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. Most of the time, these questions are first or second order questions. So just memorize the details and be able to differentiate between vitamins characteristics. So that's the main thing you should gather from this video, is pattern recognize these vitamins in NBME style vignettes. So that will do it all for the video, guys. This is FixerMed signing off. Be sure to have a great day. Good luck studying. Goodbye, everyone.